Alrighty, thank you, my friends, for joining us here on another episode of Extreme Health Radio. Really excited that you're here. Happy Friday, happy holiday season. I hope you guys are having a great holiday season, Christmas season so far. It's been a lot of fun for us. This is our first holiday and Christmas season with twin boys, so we were just talking with Dr. Freeman and Dr. Stuart Nunnally before we started the show about twins, and so we'll talk about that. But this has been a lot of fun for us, having boys and Christmas and kids. This is just so much fun for us. So hopefully you guys are having a great holiday season. This is episode 640. So if you guys want to grab the show notes, it'll be available. Everything will be available at extremehealthradio.com/640. This is going to be a great show. If you have cavities, if you have root canals, if you've had wisdom teeth extractions like I had, if you have any dental issues at all, you'll be probably very surprised to know that your oral pathology, your oral and dental health plays a much bigger role in your health than you probably imagine. And this is going to be a great show. We're going to talk about how oral pathology plays a role in our entire health. And we've got some new research, some new data coming in now that Dr. Nunnally and Dr. Dr. Freeman, Elaine Freeman was talking about before the show. So this is going to be a great show. Share it with your friends if you are interested in doing that. That would be great. Like I said, it's episode 640. And let me bring up our show schedule. We've got lots of really cool stuff happening on Extreme Health Radio. Let me bring up our little show schedule and tell you guys a little bit about what's going on. We broadcast live every Monday, Wednesday, and Friday at 10:45 a.m. Pacific time, and it's a lot of fun. Everything is available on YouTube, and you can ask questions to the guests. And let me share and just show our upcoming show schedule. Lots going on. So today, obviously, we're going to be talking about biological dentistry. Then on Monday, we're going to have Matt Maruka. He'll be talking about the light diet, about blue light toxicity and blocking blue light, all that kind of fun stuff. And then it seems like next week is all about light, right? Because we have Scott Nelson on Wednesday, and he'll be talking about the photobiomodulation light therapy device that we use a lot, called the Juve red light therapy device. And then we have Dr. Randall Tent on Friday, Nathan Walls next Monday. So lots of cool stuff happening. So make sure to subscribe. Make sure to click the like button, share it with your friends. If you guys want to share it with your friends, we'd appreciate that. Lots going on. Make sure you don't miss any of our shows coming up, because it's, like I said, a lot going on. So today we have Dr. Stuart Nunnally and Dr. Elaine Freeman from Healthy Smiles for Life, and they are our dentists. We're going to be going out to see them very, very soon. That's going to be a lot of fun, and we're going to introduce our twins with his grandbaby twins. It's going to be a lot of fun. And so Dr. Stuart Nunnally is a graduate of the University of Texas Health Center School in San Antonio in 1980. He maintains an integrative biological dental practice in Marble Falls, which if you haven't had a chance to check out yet, I recommend going out and seeing him, Dr. Elaine Freeman, Dr. Owens, and getting your teeth worked on by these people. They are incredible. And he's been at this for 30 years now. And Dr. Elaine Freeman, she works with Dr. Nunnally as well, and she is a member of the American Institute of Implant Dentistry. She's been joining him since 2002, and they do some great work out there in Marble Falls. So let me bring them up, turn their microphones on, and bring them in the show. Hi, Doc. How are you guys doing?
Good morning.
We're doing great.
I'm so glad to have you guys. So great to have you guys here, and it's been a couple years, I think, hasn't it?
I think it has. It's fun to be with you. I was thinking when you were introducing Lane, it's hard for me to believe that she has been right here since 2002. Although Lane grew up in this practice, and she's an unbelievable partner and a fabulous dentist, and almost like my daughter, And it's interesting, Justin, when she joined me officially in 2002, I walked out. I was sick. I was sick with a mercury toxicity issue, and Lane came in and took over an incredibly busy practice, and she's never slowed down a moment since.
Oh my goodness. Wow. 2002, so 16 years you've been there. And how long has the clinic been going altogether?
This is year 38.
38 years, my
Yes.
goodness, that's so great. And Dr. Nunnally, I think I've heard you say before that you've been living in Marble Falls your whole life, right?
My wife and I were both raised here, and yes, we actually live. If you can imagine, we live in the house where Rebecca was raised, and we just love this little country town outside of Austin. It's a fabulous place, clean air and clean water, and wonderful people.
Oh my goodness, yeah, it's such a great spot. And Dr. Freeman, and you've been working with Dr. Nunnally since 2002, and then what were you doing before that?
Before that, well, I grew up here in Marble Falls, also moved here, but I was very young and grew up here and was actually a patient my entire life growing
Uh-huh.
up in this practice and really developed an interest in dentistry here, worked here in high school and in college, and that's when I began to pursue my dental career and then was blessed to be able to come back here when I graduated from dental school.
Oh my goodness. So you guys probably see a lot of people. So are the majority of your clients and people that come see you, are they people that understand the whole holistic approach to biological dentistry, or are they typically just people off the street that don't understand the connection between it all, do you think?
I would say we have a pretty good mix. The majority of patients have sought us out through research because they're seeking a more biological approach to dentistry. And so they've done a lot of research or they've been educated by a holistic physician, integrative medicine doctor. But there are some who come in, and as we just begin to explain to them our approach to things, they're very open to a more holistic biological approach. So I think we have a good mix of both and educate patients that come in very educated and those that are really ready to learn about it.
hmm And Dr. Nunnally, you were sharing with me before we started and went live today about some new research, because we're going to kind of focus today's call about root canals and cavitations. And I actually have the PDF printout report that I'll share later on in the show of the testing that you did on my 4 cavitations along with my 2 root canals. So that's going to be I'm curious about your thoughts about that. But you were sharing with me a little bit about some new research that's been coming out with regards to root canals. Is that right?
Well, there is, and one of the wonderful fact gatherers in our world is a gentleman named Tom Levy, and Tom sort of, I would say, wrote the Bible as far as vitamin C goes. He's a cardiologist who had life transformation experience through dentistry. He was basically bedridden, and he became acquainted with Hal Huggins back in the 90s. Dr. Huggins encouraged him to get his root canal treated teeth out, and it's almost like he was transformed overnight.
Wow.
And so he's become quite an avid researcher, or he's really been one who compiles the literature so beautifully. He's done that in a number of books, but his latest book, called Hidden Epidemic, compiles research all the way up through 2017 regarding cerebral artery disease and coronary artery disease and their relationship to root canal treated teeth and cavitations, and even advanced periodontal disease. So we'll share some of that with you as we go forward today, but it's very compelling. There used to be dentists who would say, well, show me the research. Well, if you want to pick up Levy's book, it's very, very well researched, and I'm sure it's close to 1,000 references in that book, and you'll see the undisputed evidence that root canal treated teeth can cause systemic illness.
Mm. Well, yeah. What's the name of that book again?
It's called Hidden Epidemic. I have one in front of me. Let me see if I put it up here. Will it show?
Oh, there we go. Yeah, Hidden
Yeah, right
Epidemic.
here. Hidden Epidemic by Tom Levy.
Wow.
He's a physician, a cardiologist, and also, interestingly enough, an attorney. He's a lifelong learner.
Oh, really? He's an attorney too.
He is.
Wow, interesting. So, yeah, he's been on our show a while back, and like you said, he does a lot of work with vitamin C these days, right? That's the bulk of his
He
work?
does. Yes, I'd say the bulk of it is. But this is such an interesting book that he's just recently published.
hmm And Doc, for those that don't know your story a little bit, I think we've done a handful of shows with you so far, but in case people are just sort of new to your work, share people a little bit about your backstory with regards to how you got into biological dentistry and what you thought was ALS at at a certain time in your life, right?
Well, there was a time that was the motivator
Yeah.
for moving us in this holistic direction because I had, even when Lane was growing up in my practice, I thought that I was a holistic dentist because we didn't place mercury fillings,
Right.
and we hadn't placed a mercury filling in 20 years when I became ill, and
Uh-huh.
I started having neuromuscular issues, and it was a very tough time in my life. I had all three kids at home, and Rebecca and I were uh, living large, enjoying life, and all of a sudden I began to have these neuromuscular issues. And finally, after months of testing, my neurologist referred me to the Lou Gehrig Center in Houston. We all thought I had ALS, and I was totally convinced of it. And as a result of that, I went to Montreal for treatment. I saw the old grandfather of holistic dentistry. His name was Hal Huggins.
Uh-huh.
And at that time, we all were convinced that I had ALS. I certainly had a lot of the symptoms. But as it turns out, it was a mercury toxicity issue, not because I had any more mercury in my teeth. I had had that removed years ago, and not because I was placing mercury fillings, but I was removing them vigorously. There were a number of physicians that would send their patients to me to remove the fillings, the mercury fillings.
Uh-huh.
And I was taking really no precaution myself
Wow.
against that, which was foolish. I should have known better.
Yeah.
But at any rate, I do know better now, and I'm not foolish in that regard anymore. But
Yeah.
at any rate, for about 20 years, I removed a lot of mercury fillings. It finally overwhelmed me, and I began to have those neuromuscular issues. But after several years of not being exposed anymore to mercury and um, doing all those things to detoxify, I'm back 100%. Very
Wow.
grateful to be alive. I'm so grateful to be practicing still and have such an incredible staff and three unbelievable partners.
Oh, it's amazing. It's amazing. And Dr. Freeman, what is the current state? Do you know with mercury fillings? Are they still sort of phasing them out, or have they ever admitted that they're maybe it might be toxic or any of these things? Like what's the current state with this mercury fillings?
Well, the current state is that definitely they haven't been declared unsafe officially
Okay.
by the American Dental Association or any official entity. However, more and more patients are pushing to not have metals and mercury fillings in their mouth. So that's a good turn.
Oh, good.
But they are beginning to phase out, but you will definitely still see offices that place those. So patients definitely want to be educated on what's going into their mouths.
And Dr. Freeman, a lot of people are calling themselves biological dentists, right? And they're still working with root canals and mercury fillings. Is that true?
Well, I don't know that any biological dentists are still actually, if they claim to be biological, I would be very, very surprised if they actually placed any mercury fillings. However, they might not use all of the protection protocols when they're removing mercury fillings that would protect the patient and also protect them and their staff. So there would be some good questions that a patient can ask their dentist if they claim to be biological, making sure that those protections are in place. As with root canals, there's still there's a little controversy still even among biological dentists as far as root canals are concerned. I think with this new research that Dr. Nunnally will be sharing today, that's going to really be phased into the information that gets out there. So we'll probably see a change in that, but definitely there you can see both ends of the spectrum, even with biological dentists. So once again, lots of questions for patients to ask whoever they're
Yeah.
seeing.
Yeah, it's so crazy, the landscape of it all. I remember one of the best things I ever did was coming out and seeing you guys in 2010. I think we did a couple trips to you. In 2010, Dr. Freeman, I came and saw you, and I think I had 5 or 6 mercury fillings removed. And then I think maybe in 2013 or 14, we came and got my cavitations fixed and the root canals. And man, what a just a blessing that was, and just to get all of that stuff out of my mouth and all of that toxic burden to your immune system. It's just, I'm so grateful to have that gone. When it comes to mercury fillings, Dr. Nunnally, what do you think should people look out for if they're going to go and thinking about getting those removed, and they're looking for a dentist? I recommend just everyone go to see you guys, but not a lot of people can travel and do all that. But what should they look out for with their dentist with regards to how a dentist would remove a mercury filling? Because there's a lot of like safety precaution measures, right?
Absolutely. Yeah, I would make sure that my dentist, at the very least, is using a rubber dam. A rubber dam helps isolate each tooth so that there's no particulate of the mercury filling going down your throat when
Okay.
it's removed. And then that's the first line of defense. If a patient just goes and interviews a dentist and says, "Do you use a rubber dam when you remove mercury fillings?" and they say yes, well, then that would be a good first clue that that's someone who's being conscientious about removing the mercury. If you want to really hone in on this whole idea of removing mercury fillings in a very safe way, you would go to iaomt.org. That's iaomt.org, which stands for the International Academy of Oral Medicine and Toxicology. It's a fabulous science-based organization that has created it's created a program called the SMART program, SMART, which is an acronym for Safe Mercury Amalgam Removal Technique. There you go. And if you go to the SMART program, you can find a dentist who's SMART certified. So I would do that. There are many SMART certified dentists now around the world. I would think it wouldn't be too difficult to find someone who is SMART certified. And those dentists have had additional training in removing mercury fillings in a very safe way. They have signed a pledge to our organization, International Academy of Oral Medicine and Toxicology, that they will do it in that safe manner. And if they don't do it in that safe manner, the organization welcomes feedback from patients to make sure that, like, if you were to see a dentist and he or she didn't follow that protocol, they should be reported so that people know, hey, they're not doing what they say they're doing. I think that's a great spot to start in terms of looking for a dentist who really wants to be conscientious about mercury removal.
Mm-hmm. I know it's kind of anecdotal, but before we knew anything about any of this kind of stuff, we went to a dentist down in Mexico who was just a conventional dentist. And I think Kate had a bunch of her mercury fillings removed, Doc, and it was like the health cascades that she had, the ramifications of that. I'm sure you guys both have heard stories of these types of things, but the ramifications of her getting those mercury fillings removed in an unsafe way had a devastating effect on her health. And she had issues with her pancreas, her liver, and all of these things that started about a year after that, and then progressively just got worse and worse and worse. I know it's kind of anecdotal, but I mean, I know both of you guys have mentioned that, 1 atom of mercury is unsafe, right? This is not safe stuff.
No, it's not. And that story, that Kate's story, is a very, very common story. Oftentimes, it happens within days or even hours after having removed mercury fillings unsafely.
Wow.
And there's no barrier C to mercury, so it can impact any system. It loves neurological tissue. That was its favorite home in my body. But it also loves the kidneys. It impacts the pancreas, as you said. The liver is a major detox organ for it, so it gets hung up there. And so you can have a whole host of ailments because there's really no barrier. Any system can be impacted. That's what makes it so difficult also to diagnose and to treat. That story of Kate is one we hear every week.
Mm. Yeah, I know it happens quite a lot, and I'm going to bring up a picture, you guys, of Kate, and before and after her root canals got fixed with you guys. I'm going to bring this up on the show page if you guys are watching on YouTube on our show, and check this out. This is a picture that we posted on Instagram, gosh, maybe a couple years ago. But she had some sort of warts going on. I know this is anecdotal too, but she had some sort of warts going on, like maybe these flat warts or something that was on her left thumb on the big knuckle there. And then literally within hours of getting work done at your facility with both of you guys, her warts started to go away, and she had been working on these for about 5 years. Isn't that crazy?
We broke up just a little bit there. What did you say right before 5 years, Justin?
Oh, I just said that she had been working on trying to get rid of those warts that were on the big knuckle of her left thumb for about 5 years, and then within probably a day or two of seeing you guys and getting work done at your clinic, they just started to recede. They just started going away.
I love that. And see, that's another example of the fact that there's no barrier to mercury. Oftentimes it does show up on the skin. It can show up as blisters. It can show up as some of the most bizarre lesions, and some of honestly the most unbelievable things I've ever seen are when a patient had mercury removed and either they were exposed to it or they begin to detoxify quickly afterwards. And sometimes, even if it was done properly, a patient will begin to lose the mercury out through little blisters on their skin. We've seen them all over patients' torsos, arms, and legs, and typically those go away quickly. I think in Kate's case, it was just a 24/7 exposure, obviously, that was her issue, maybe to the root canal toxins, and then getting those out, they began to resolve.
Mm-hmm. Yeah, we're so blessed to have done that, because this and seeing you guys was part of what we were doing to prepare for our twins. We didn't know we were going to have twins, but to prepare for having babies is getting the root canals fixed, getting the mercury out, and all of that as part of a detox strategy for being a healthy carrier for babies. So that was a big part of our strategy, and it proved well for us. And luckily we did this, years before Kate got pregnant, which was great. Dr. Freeman, going back to the root canals again, what are some of the main dangers that you see? Because root canals it's sort of unlike mercury fillings in the sense that mercury fillings seem to be being phased out a little bit and people are waking up to them more. But when you just go talk to people across the street or just out and about, no one really thinks that root canals are really that big of an issue. But I'm starting to think they're a bigger issue than most people even realize. What are some of the main issues with root canals these days?
Well, I think, there's a lot of research that we could share, but when you're just talking just in layman's terms and just in terms of logic, what you have to understand about a root canal, and this is a conversation that I have multiple times a day with patients, is that a root canal treated tooth is essentially a dead tooth. It's got dead tissue contained inside of it. And we know in the medical community that really nowhere else in the body do we accept that dead tissue is biologically compatible. And so it really is the same if you think about it in the mouth. You don't want dead tissue inside a tooth in your mouth because bacteria loves dead tissue, loves a stagnant blood flow, loves dead tissue. And so when you're thinking about that, that's what's in your mouth, just from a logical standpoint, you can see where that would cause problems. So all of those toxins that are released from those root canal treated teeth definitely affect different people in different ways, but can be just a low level, at the very least, a low level chronic irritant to your immune system. You look like you have something ready to share.
Well, I'm ready.
He's ready.
Yeah, well, no, I was just I was just curious too. I guess it depends. There's probably no way of knowing this, but I felt like when I got my 2 root canals fixed or taken out with you guys, I feel like it was just a major toxic burden that was just lifted off my immune system. And so what I've often wondered is, how much of a burden is this placing on the immune system? It's like I said, it's probably impossible to know the answer to that question, but just intuitively within my own being, it feels like it was putting, I don't know, 30 or 40% of my entire immune system load just on that. And I'm sure with the turnarounds you guys have seen, you've seen the anecdotal representation of that with people's health turning around, right?
Absolutely. And everybody is different in how they respond to any toxin. But also, if you think of it as a cumulative effect, someone may have had a root canal for a long time that their immune system just really has kind of handled. It's still an irritant and a load to it. And then you start to add on some other stressors onto the immune system, and that becomes a bigger deal all of a sudden.
That's right. Listen to this quote by Levy in his book, Hidden Epidemic, page 168. He says, chronic apical periodontitis, which is sort of a technical name for the infection that we see in root canal treated teeth. He says, now this is a smart man. He's a board certified cardiologist and attorney to boot. And he says, this is the main cause and aggravator of heart disease, cancer, and most chronic diseases. Now, that's a bold statement.
That is a bold statement.
Now,
yeah.
He supports it very well in this book, and he brings to light the fact that within the last year, not the last year, but within the last 4 years, there are 4 sort of smoking gun studies that have demonstrated that the bacteria that you find in root canals are the same ones that you find in the atherosclerotic plaques of coronary artery disease. So in other words, you go in for a bypass and the cardiologist or the thoracic surgeon removes or cleans out your vessel, coronary artery. You can take a sample of that and match it up with the bacteria in your root canal treated tooth. So,
wow.
We didn't have that data really until 2013, but now we have it conclusively in 4 very well designed peer-reviewed studies. And they also now have the same study with cerebral artery disease. In other words, a stroke victim goes in, neurosurgeon takes a sample of the plaque that's occluding an artery in the brain and matches that up with the root canal treated tooth. We're going to design our own study here where we have a dear friend who's a surgeon and does a lot of vascular surgery. And I have a feeling that most of the vascular thrombosis, in other words, like where you get a blood clot in any vessel, I have a feeling that most of those are the result of some sort of a dental issue. It may not be, but we're going to have a study in the next couple of years that will see if that's true or not.
Wow, that's so incredible. So what was his quote? He said heart disease and cancer and something else?
Yeah, his quote is this. CAP, which is the acronym for chronic apical periodontitis, is the main cause and aggravator of heart disease, cancer, and most chronic diseases. And he makes the point very clearly. It's a very, very, very well documented book.
That is so incredible. Like you said, I mean, that's a bold statement. So he says the main cause of cancers. I was just reading something the other day that I think I was under the impression that I read some studies years ago saying that cancer, I think it was 1 in 3 women were going to be diagnosed and then 1 in 2 men. But then I just read a study the other day that was saying 1 out of every 2 across the board for anyone that was born after 1960. So that's just a flat 50% of everybody. And if Dr. Levy is saying that the major cause is oral pathology, that's a huge bold statement. So I wonder how does this play out with regards to cancer, for example? Like what's going on with the connection between the two, do you think?
Well, there are several connections. One is teeth are on meridians that impact various organs in the body and various other structures, not just organs, but there are some teeth that, for example, all teeth are on various organ meridians. And we don't think that much about this in Western medicine, but this is something that in Eastern medicine or Chinese medicine they would think about before they think about anything else. In other words, if you have a diseased part of the body, what other part of the body might that be impacting because it's blocking an electrical circuit?
Uh-huh.
And so one of the teeth that happens to be on the breast meridian is a bicuspid tooth in both male and female. And so there are especially physicians around the world who have noticed over the years that women who had a root canal treated tooth on the breast meridian were much more prone to have cancer in that breast. We've seen that in our clinic. We don't have any hard scientific data. And I'm not sure that I've ever seen a published paper on this, but I've certainly seen people anecdotally suggest that. And it seems most often when we see patients, so many of our patients are referred here because they have cancer and their physician wants us to remove anything that might have a toxicity associated with it that might be challenging their immune system. Oftentimes we see in these patients, we'll see a root canal treated tooth on or near that breast meridian. So that's one way. The other is, Justin, that whenever you have a root canal treated tooth, it is, just as Lane described a while ago, it's a challenge to the immune system. And so when you have cancer or any other disease, systemic disease, you want your immune system functioning at its best.
Mm-hmm.
You want to have an immune system that can identify a cancer cell and eliminate it, and an immune system that doesn't recognize itself as an enemy. In other words, where you're developing an autoimmune issue.
Right.
So what we think is true in dentistry is that there's hardly anything that impacts your systemic health more than teeth and gums do. Tonsils too, by the way. Tonsils can have some of the very same bacteria that we see in teeth and gums. And Levy makes that point in his book also. He feels like probably far too many tonsils are left undisturbed when they're chronically inflamed and infected.
That's so fascinating. All of this stuff is so interesting to me. Dr. Freeman, I think you guys are both familiar with Dr. Stephen Hines down in San Angelo, Texas. I think that's where he is with Hope Wellness Center. And I think I remember him speaking one time and saying that they've actually have x-rays showing some sort of a line. Is it a line or is it some sort of indicator showing from someone's infected root canal going all the way to a breast tumor? Have either of you heard of that, or is that just a traditional x-ray? Do you think you might be speaking about there?
I wouldn't think it would be a traditional x-ray. Do you know
No.
the answer on that?
No, I don't. But what we do know, of course, is that the lymphatics from the teeth drain to the mandible. That drains right down a chain of lymph nodes, oftentimes into the axillary area of the armpit, but also into the breast.
Wow.
So there's a straight communication there from dental infections to the breast.
Yeah, so fascinating. I hope you guys are enjoying this show with Dr. Stuart Nunnally, our biological dentist, and Dr. Lane Freeman from Healthy Smiles for Life. This is so good. We're going to take some questions from the chat room after the break here in just a second. But I highly recommend, one of the best things that you can do for your health is to go to Healthy Smiles for Life. Go to their location and get your teeth worked on by them. They're incredible. It's one of the best things we've ever done for our health, and we're such big fans of what they're doing. And after the break, I'm going to share I think I'm going to share the PDF report of the actual toxins and bacteria that was coming out of my teeth when I went to go see them last. It was just absolutely crazy. One of the things I wanted to tell you guys too about is this water filtration system that we have been using now in our house for probably, I'd say, about a year. Let me bring this up on our show page here. And just the other day I was doing, so check this out. I was on EWG, Environmental Working Group.org, and I was looking at our water system here in San Juan Capistrano where we live, and I was looking at the different chemicals and things that they found. And if you guys are watching on YouTube, you can check this out. It says 10 contaminants detected above health guidelines, and check these out. So they are, I can't even say some of these words, bromodichloromethane, and that's correlated with cancer, and it has a whole write-up about how this affects your health. Bromoform, which is also correlated to cancer. Chloroform, which is also related to cancer. Chromium, which is a hexavalent, also cancer-related. I can't even pronounce some of these words. Dibromo, I can't even say some of these words are so long. But look at all these things with regards to the chemicals that are in the conventional tap water where we live here in San Juan Capistrano, Southern California. This is just unbelievable to me that these things are in our tap water, and that's why we use this water filtration system here, Omica Organics. I had a good talk with the owner of them a couple months ago, Rafi, and he's a great guy. This is a 12-stage reverse osmosis water system, and let me bring up some of the things that it actually removes. It's pretty incredible when you look at all the different things. It removes 99.9% of contaminants up to 1,000 gallons, including aluminum, arsenic, chloramine, chromium, copper, lead, mercury, pentavalents, radioactive particles. Total dissolved solids obviously brings those way down. I did a test recently, and I think the TDS was, oh gosh, I think it was around 30 or 40, which is very low. I think it's in the high hundreds before I tested it. It also gets rid of volatile organic compounds, colloids, fluoride, which is huge, antimony, cadmium. It just gets rid of everything. And this is a 12-stage reverse osmosis water filtration system. And it's the one that we use. So we have their water filter underneath our sink in our home. And we also have their water filter in our shower as well, because you don't want to be getting any of these chemicals getting onto your skin and causing health issues. A lot of people don't realize that your skin actually uptakes and allows more water to come into your body than just drinking it when you're taking a shower, especially when you're breathing the mist. And it's just really important to make sure that your water is nice and dialed in. And so I highly recommend. A lot of people have been asking us what water filtration system we use. This is it. It's the Omica Organics 12-stage reverse osmosis water system. And it's available in our store. If you guys want to go check it out, we would greatly appreciate that. And I think you guys will love it too. Get it installed and put it underneath your sink and start giving your family nice water to drink. And one of the other things I wanted to tell you guys about too was the Stockton Aloe One. I don't know if you've been to the health food store lately. You've probably looked at aloe vera there, and you see that there's a lot of other excipients and weird ingredients, and it's a lot of bizarre kind of stuff happening when you get aloe vera at the store. The best option would be just to grow fresh aloe vera yourself. But if you can't grow it yourself, Stockton Aloe One is amazing. It's 100% organic. It ships to you fresh, frozen. And the benefits of aloe vera are just, it's like the original superfood that we have been eating for, the entire time we've been on this planet. It's got 75 different active compounds, vitamins, minerals, enzymes, amino acids, long-chain sugars like polysaccharides, lignans, mannose. But it's got this really interesting substance in it. Let me see if I can pull this up here. It's got a really interesting substance called ace-mannan. And apparently ace-mannan induces macrophages to produce interferon, interleukins, and tumor necrosis factor A. Now, we can't really make claims about this, and I'm not going to say it does anything, but that's the research that we came across. And this Rodney Stockton, who's the owner of Stockton Aloe One, he lived till he's about 96 years old. And he, of course, attributed his long life to the daily consumption of aloe vera. And let me bring up this little clip here from one of our previous guests, Jason Prawl, really great guy, and listen to what he has to say about aloe vera. I'm sorry, this is the Magnetico. My mistake. This is actually, I'm going to bring up Dr. Donnie Wilson and listen to what she has to say about aloe vera with regards to leaky gut.
And then I encourage, we can talk more about this. What do I do to help people speed up the healing of leaky gut?
Mm-hmm.
I mean, you mentioned aloe before,
Mm-hmm.
and that is one of the herbs that I definitely recommend, using for helping to heal leaky gut. You want to use herbs that are anti-inflammatory and soothing and healing to the intestinal lining. So aloe is a great one.
So go over to our store, check it out, Stockton Aloe One. I think you guys are going to really love this stuff. It's really great to take it every single day. I'm a big fan of it. Take it every day myself, and I love sharing products that we use and love and enjoy, and then sharing them with you guys because I know that they're going to benefit your health tremendously. So I'm actually also going to bring up, let me see here. I'm getting used to this software here that we're using for this show. I'm going to bring up our root canal and cavitation information that we had with Dr. Nunnally back a couple of years ago. So let me bring this on the show, and you guys can take a look too. These are the types of things that are living in your mouth that you probably don't know. So with me, I had a root canal. I had 2 teeth, root canals number 12 and 13, and the following bacteria were in the sample. So I can't even say some of these words. Capnocytophaga. I literally can't even say some of these words. But this one, it says here, according to the study, that anything above 7.5 is dangerous. And it says here that the symptoms of this particular bacteria, it causes localized infections in healthy individuals, but can cause a wide variety of potentially serious infections in immune-compromised patients. This bacteria, I can't even say the word of it, can cause overwhelming sepsis in asplenic patients, the elderly, and any other immune-compromised people. So my level was 9.6, and I think anything above a 7. A 9 or greater indicates a serious risk. So this is what was going on in my root canal. So this is just crazy. And then also, these are the 4 cavitations that I had worked on with Dr. Lane Freeman and Dr. Nunnally a couple years ago. And the same is true here. I think 7.5 or less or greater indicates a serious risk. 9 or greater indicates a serious risk. And I have these 4 different bacteria, and you can read about what they all do, but one of them was very dangerous in my case. And some of the symptoms were under immune-suppressed or traumatic conditions. Peptostreptococcus micros can become pathogenic. The organism can cause brain, liver, breast, and lung abscesses, as well as generalized necrotizing of soft tissue infections. My goodness, isn't this unbelievable what is living in our root canal? So let me bring both doctors back on and see what they have to say. I can't believe I'm still alive. How am I still alive after all that? It's crazy. I couldn't even pronounce some of those words, but so how serious of a risk do you think it was, Dr. Freeman, having some of those be above a 9, do you think?
Well, it just shows you that your immune system was definitely having to work all the time with that just sitting in your system.
Yeah.
And Dr. Nunnally had mentioned that really what your report is one of the better ones that we've seen. Many times we see, closer to 10 different strains of bacteria that can be identified either in cavitations or root canals. And so it's a testament to our immune systems that they do handle those things, but you can see where things could start to go haywire. The immune system can be overwhelmed by the amount and type of bacteria that are found in root canals and cavitations.
Yeah, and so, Doc, what are some of the worst cases you've seen? You said that there's been a number of people with multiple, double or triple the amount of bacteria. What are some of the more, I guess, bacteria that we would know that are really dangerous that might be living in people's root canals or their cavitations?
Well, they're a lot of times, Justin, they're normal inhabitants of the mouth. They're bacteria that we have, but these bacteria are clever. They slip into a root canal treated tooth. See, a root canal treated tooth no longer has a blood supply to it. So these bacteria can get into the tooth. It's no problem whatsoever for them to enter into the tooth. And because if you look at a tooth under a microscope, it really looks more like honeycomb than it does a hard surface. Especially once you get to the dent in the tooth where the tooth is not covered with enamel. It looks like a honeycomb, and it's just filled with these little microtubules that bacteria love to get into. And bacteria are clever. They can switch from being aerobic bacteria, which we find as most of the harmless bacteria in our mouth are aerobic. Once they become anaerobic, it becomes a game changer. And bacteria can pleomorph, that is, they can just change from aerobic to anaerobic. It'd be like you and me going down to the beach this afternoon and sprouting a set of gills and some fins and jumping in the water and just diving down to 50 feet and hanging out for the rest of the day.
Might be kind of nice. Yeah.
Yeah, exactly. So that's what they do. And once they become anaerobic, then they begin to produce toxins. I mean, it's literally their waste products. Their toxins are potent. So bacteria are the common bacteria that we see, like, for example, like Clostridia botulinum. Okay, that's a bacteria. That's a bad bacteria. It causes botulism. The bacteria is bad, but it's not so much the bacteria; it's the toxin it produces that's really bad. Or Clostridia tetani causes tetanus.
Wow.
Well, that's not a good bacteria, but it's not the bacteria that causes tetanus. It's the toxin. It's the waste product it produces that really is the problem. So these bacteria get into the tooth. There's no blood supply there for you to deliver your own white blood cells and immune system there to help clean them up. And they just have a heyday. It's a party. And some of us can handle that beautifully, and some of us can't. You put those root canals that you had in a little 100-pound woman like Kate, it can be a much different scenario than it is in a big, strapping, healthy man. Yeah. So we all handle these toxicities different. As you know, Justin, people can smoke forever and have no health issues, and others can smoke for a year and have carcinoma of the lung or be around secondhand smoke.
Yeah.
So we're all wired so differently. And so that's sort of the story of these bacteria.
Yeah, we had a really interesting guest on recently, a real scientist. Her name is Amy Prohl, PhD. I think she's in California, and she was talking. We're talking about the microbiome of the body, and she was talking about how it's really interesting. Most people think microbiome just of the gut, but she was saying that the liver has its own microbiome. The lungs has a different microbiome, and she was talking about viruses will actually take over a bacteria and cause the bacteria to turn off the cell receptors on a cell, the cell wall receptors, to allow for co-infections and to allow for different things, to biological processes to happen. So a virus will actually overtake a bacteria, so that it can carry out some kind of a function within the human body. And then she was talking about once those viruses have taken over those bacteria, they'll set up, what are those things called? Biofilms. So they'll set up biofilms in the body. And there's now, apparently, according to her, there's new research from the University of San Diego showing that the bacteria that now have a biofilm and living within a biofilm can actually communicate electrically using the same electrical signals to another bacteria in another biofilm in some other part of the body, using the same electrical signals and through our nervous system. And I had never heard of that before. And when you're talking about the bacteria in our mouth and what viruses might be on there, I mean, do you guys think that even with all that we know, there may still be even more that we just have no idea what's going on in the mouth? It's so complex, isn't it?
Absolutely. I think there's a ton. We're still learning every day, every year. We're learning more, and it's exciting, but it's pretty amazing. I'm sure there's a lot that we do not even comprehend yet.
It is.
And it's not ever one single species. That's what's, we would love just to have one bacteria to target.
Right.
And, but it's a complex microbiome. There are hundreds and hundreds of different bacteria that inhabit the oral microbiome. And then, of course, there are hundreds of thousands, at least 10,000 different species that inhabit the gut microbiome. So it's a very complex issue. And we're just talking about bacteria. What you were saying a minute ago, every biofilm has not only the bacteria, but it has viral particles. It has yeast, fungi in it. So it's always a co-infection.
Yeah, always something going on. Back in 2000, I think it was 99, 2000, before I knew anything, obviously, about this alternative health world, I got four wisdom teeth extracted. And it's funny because I don't even remember why. I think maybe an orthodontist maybe said that your teeth are a little too crowded. You should go get it done. And under the sort of inclination that, like, we don't need these wisdom teeth. You don't need your tonsils. You don't need these organs, right? So with that kind of mindset, I went and got all four of them removed. And so, Dr. Freeman, explain a little bit about, like, what's going on when someone gets like a wisdom teeth removal. Why can't we have space for these wisdom teeth? How come there's not enough room in our jaws? I know that's a whole separate question, but what's going on with wisdom teeth extractions and cavitations and how they affect our health, do you think?
Well, definitely that is a good question on why we don't have room. There are other cultures where the jawbone definitely accommodates the wisdom teeth all the time. But definitely in our Western culture, there are many cases where the jawbone just won't accommodate all 32 teeth. You really don't have room for them. But it does need to be evaluated for everybody individually. It's not just something that we just should arbitrarily suggest that someone have their wisdom teeth removed, or really any other organ, without an actual need being determined. So we look at x-rays all the time for patients and determine, especially with wisdom teeth, that yes, it looks like these are going to have plenty of room to grow in, and you should just allow that to happen naturally. Or many times we see that there's just going to be too much crowding. The jawbone is too narrow, the patient is just a smaller framed patient, and there's just not going to be room. Or perhaps those wisdom teeth have grown in at an angle, and there's just not a way to make them healthy. And especially with orthodontics, they definitely don't want those wisdom teeth causing problems later. So they will recommend that. And so in many cases, it is appropriate to have those wisdom teeth removed. You asked about then that leading in towards a cavitation. When you take out a tooth, and it could be any tooth, it doesn't have to just be a wisdom tooth, but if it's a wisdom tooth that hasn't erupted, it hasn't come into the mouth, it's going to be surrounded by a developmental sac. If it's a tooth that is already in the mouth, whether it be a wisdom tooth or another tooth that you have extracted, it's going to be surrounded by a periodontal ligament. So when you take a tooth out, you want to set the body up for the best healing process that it can have. So you don't want to leave anything in that socket, that bony socket, after the tooth is removed. So our philosophy is that you would go in and clean that socket out after you take the tooth out, that you would debride that and clean it so that it's just good, healthy bone with good blood flow. And then the body can fill that in properly. But in many cases, that's just not how a tooth is removed. It's just removed quickly, and the patient's given some gauze to go home. And there are times that the bone will heal just fine, but in many cases, that'll result in there just being some things that are in the way that don't allow the bone to heal properly. Perhaps the blood supply can be compromised in that area. So everything heals up on the outside and looks great. You look in the mouth, you don't necessarily have any pain, but on the inside, that bone just doesn't properly heal. The blood flow is stagnant. The bone can begin to form, but gets interrupted, and so you can have some necrotic or dead bone in there. And that's where we have a problem. Once again, like a root canal, you have dead tissue. And bacteria, as Dr. Nunnally mentioned, loves a setup like that. Not a lot or no blood flow, some dead tissue in which to set up camp at, and it just then can, from there, affect the immune system just like a root canal treated tooth would.
Mm-hmm.
You have anything to add to that?
Oh, exactly.
Yeah, root canals must be a big profit moneymaker, because dentistry seems to be the only sort of sector of health that where we leave a dead organ in the body. So it must be a profitable endeavor for dentists, right?
Well, there'll be about 25 million root canals done this year in the U.S. And
wow.
So at $1,000 a pop, that's 25 billion. It is a lucrative business, and there's some real resistance to acknowledging this kind of research that Levy brings out in his book, because it means that a whole segment of the dental profession would have to look for something else to do. And I don't mean to be mean-spirited or hard on endodontists and people who do root canals, because it does save the tooth oftentimes. And some people don't seem to be impacted by those toxicities at all. Mm-hmm. We have old patients who've had root canals for years, and they're robustly healthy. Mm-hmm. And so we never push people to have root canals removed. As it turns out, in our practice, Justin, we're seeing mostly people who are sick, who have been referred to us because their poor immune system needs all the help it can get. Mm-hmm. And so we still don't take it lightly. Removing teeth, there's a downside to having a tooth removed too, oftentimes. And mm-hmm. How are we going to replace that? How are we going to make it to be aesthetic and function well? So all of those things we don't take lightly. We want to look at every patient individually and try to make a decision with them that works best for their health, and that includes their ability to chew. Mm-hmm.
Yeah, I agree. We have a few minutes left, and we have a handful of questions that are coming in from our trusty chat room here. And maybe we'll just jump around a bit for the last few minutes here. It says, let's see, there's one question I saw just a second ago. Oh, yeah, from Grow Sanctuary. I thought this was pretty good, and I think you've addressed this on different shows that you've done, and some of our shows as well. But either of you, if you feel like you want to take this one, Grow Sanctuary says, what are some of their favorite amalgam replacement materials? My options are Admira Fusion or more expensive Sirona Ceric Blocks ceramic. I'm getting my amalgam removed early 2019 and want to hear their opinion. That's a good question.
Good question.
That's a good question. Really, either one of those would be appropriate. We do have the ability to do biocompatibility testing to really specifically hone in if a patient is very reactive to a lot of things, and we really want to be sure that every material we use is going to be appropriate for that particular patient. There is a biocompatibility testing, which is a blood test that can be done that gives you a report that lists every type of filling material, crown material, cements, everything like that you can imagine. However, those two that you mentioned, the Sirona Ceric Blocks or the Admira Fusion, both of those are items we see a lot, probably 98% of the time, as being suitable for patients to have as a restoration for when they have their amalgam fillings replaced. Now, the Admira Fusion would be if they're just replacing a filling with a new filling. The CEREC Sirona blocks would be appropriate for either a crown where you're covering the entire surface of the tooth, or if it's a little larger than a normal filling and it's going to be more like an inlay or an onlay, then that could be used for that. But either one of those are things that we see and use on a regular basis.
Okay. Yeah, that's good. Callie wants to know, this is a good question. I'm sure you guys get this a lot. Either of you, feel free to jump in on this one. It's the age-old fluoride debate, and she wants to know, what about in fluoride in normal toothpaste? So basically what she's saying is that her dentist pushes her to use toothpaste that has fluoride in it, and so she's basically trying to get your opinion about fluoride. What's your take? It's a loaded question.
I can just almost guarantee her that I would not be recommending the toothpaste that has fluoride in it.
Yeah.
Fluoride is, well, it's really the most active element in the world, on the planet. It's incredibly reactive, and it loves to compete with, well, for the most part, it loves to compete with iodine, and iodine is what your thyroid gland uses and almost every other cell in your body uses for so many metabolic processes. And I just hate the thought of using something like fluoride, which has a high degree of toxicity associated with it, has very, very little impact on decay. I hate to put anybody at risk for jeopardizing their thyroid health by using a fluoride toothpaste.
Yeah, good answer. I knew what your answer was going to be. So.
Yeah, we abandoned fluoride a long time ago, about the time we abandoned mercury. It may have hung on a little bit longer in her office, but yeah. I wish we would have gotten rid of it when we did.
Yeah.
It's fluoride to me is just, I stay a long way away from it.
I hear ya. Good stuff. Let's see, Maria, let's take a couple more because I know, Dr. Nunnally, you have another engagement. I want to make sure you're not too late for that one. So we'll take two more from the chat room. One is from Maria, and she says, is there anything you could recommend to strengthen teeth topically and internally? So either of you guys, feel free to answer that one. Oops, are you still there? Oh, it looks like we lost Dr. Nunnally. Maybe they'll come back. Let's see. They froze on us. Maybe this is God's way of saying the interview is over. Maybe not. Let's see. Maria, I was just going to ask your question about how to strengthen your teeth. That's really a bummer that they are no longer. Oh, man. Well, we got that fluoride question in, so that was always good. Let's see. Let's just hang on for another minute and see if they come back. They may try to reconnect. This is the sort of issue with technology sometimes is you get these issues and there's nothing you can do about it. So especially on a live show, it's kind of hard. There's nothing you can do about it. So Maria, if they come back, I will ask your question about strengthening your teeth topically and internally. Christina was mentioning DMSO and magnesium is very strengthening for the teeth, along with boron and silica. So Grow Sanctuary, I hope we answered your question there about the amalgam replacement materials. Beck, it's great to have you here as well. This is awesome. Beck from the Academy. Yolanda says, good morning, Justin. I ordered my Bellicon rebounder last night. Okay, cool. Thank you very much for supporting our work. I hope you get it soon. Is it a Christmas gift or is it just a gift to yourself? We're going to be getting some more springs for our Bellicon. Love that device. Just incredible. Julia is here, which is great to have you here, Julia. We're just kind of basically holding on until they come back, or if they come back. Hopefully they do. And if we don't, we're actually going to be going out to see them pretty soon. We're going to go out and visit Dr. Lane Freeman and Dr. Stuart Nunnally at their clinic. And there's a little rumor going around that a little Tweety bird told me that their entire clinic and practice has expanded. So it'll be really cool to see their new offices and all of that fun stuff. It's going to be great. Oh, I think we got them back. Did we get them back? We did. We did. Something happened. I think you cut out there, right?
We did. We don't know what happened.
That's technology for you, right?
Thank God for Lane, or we wouldn't be back.
I love it. We just had a couple more questions for you guys, if you're okay with that. We'll make them quick. We had one from Maria, and she wanted to know, I think I was in the middle of reading this one when we got cut off. Is there anything you can do to recommend strengthening your teeth topically and internally? That's a good question.
Good.
Well, obviously, the first line of defense is good nutrition, really making sure that you're eating properly, that you're not having processed sugars, that you're getting enough water, all those things that if you're living a healthy lifestyle, you're already really aware of. Oral health wise, of course, not using fluoride, that wouldn't be our answer for strengthening
Right.
teeth externally. But there are products, we have a lot of things on our website as far as making your own toothpaste so that you're eliminating a lot of additives. There's a lot of good natural toothpaste on the market as well. We recommend just using good old basic hydrogen peroxide and
cool.
baking soda. But then there are also some products. If we have a patient that's struggling with maybe lots of decay, just having trouble getting a hold on that, and we don't want to recommend fluoride, there are products that have calcium hydroxide in it. One of them is a product called MI Paste. As with anything, there are some ingredients in that might not be as suitable for every person, but that is one thing that you can look at as if you need a little extra help. But many times, if you'll just change the way you're eating, making sure that you're decreasing the bacterial load in your mouth by brushing properly, using things like a water pick, things like that, you'll find that you don't need additional things on top of that.
Okay. And Dr. Nunnally, I know you mentioned before something about the serum, the phosphorus serum level being above, I forget what you said. It was either above 3.5 or below 3.5. And I think you were talking about the acid alkaline balance of that. And if that level is above or below 3.5, then you start having issues with cavities. Is that correct?
Yeah, there was a very well-known dental researcher at Loma Linda years ago. This study was done in the 90s, and he determined that when your serum phosphorus dropped below 3.5, the fluid flow went from the mouth to the tooth.
Okay.
And with a serum phosphorus above 3.5, the fluid flow went from the tooth to the mouth, which made the tooth self-cleansing. And what happens is the standard American diet tends to drop our serum phosphorus. Interestingly enough, even high stress, but all those things that we associate with the Western diet, too much sugar, too much caffeine, too much alcohol, all of those things tend to suppress your stress, tend to suppress your serum phosphorus and make you much more prone to decay than if you're living a very healthy lifestyle. Eating good organic foods is huge. Leafy green vegetables in particular tend to alkalinize you and cause the fluid flow to go the opposite way and make the tooth self-cleansing and less prone to decay.
Okay. So the serum, meaning the saliva, the pH of the saliva, that's where the phosphorus wants to be at 3.5?
Well, not actually. We use that though. When people have more of an alkaline system, typically their serum phosphorus is above 3.5.
I see.
Yeah, but we drive it down through all kinds of things in this country. And when we see a patient who consistently has decay, even if they're keeping their mouth clean, it's a systemic issue. They have a low serum phosphorus oftentimes.
Oh, interesting. Okay. Well, guys, thanks for being on, and man, what a fun time! And I can't wait to come see you guys. We're gonna take, I think, about 3 days to drive to you, and it's just gonna be so much fun. And I hope you guys have a great holiday season too.
You too.
We do, Justin. You're going to need a little R&R here when you get to Texas after 3 days with twins. So we'll take care of you.
Yeah, that'll be so much fun. I can't wait to meet your twin granddaughters. That's going to be great, and to meet all of you guys. And actually, and
That'd
I'll
be
be able
great.
to see the expanded office too, right?
Yes, you will.
That'll be
Yes, you
fun.
will. You're
That'll
going
be.
to get the grand tour.
I love it. I love it. I love it. All right, guys. Well, thank you so much. This is good. This has been so much fun. There's so much more we could have covered, but you know what? Maybe we'll do a in-person show when we're there. That way we can cover more topics, and that'd be a lot of fun. And yeah, I love you guys so much. Thank you so much for all the work that you do. You're amazing.
Thank you, Justin.
Thanks,
Well,
Justin.
you're so kind to us, and we're so tickled that we got to meet you and Kate.
Well, thank you guys. I will be in contact with Wendy, and I'll send you the link to this as soon as it's available. And I can't wait to see you. I think we're coming out in a few weeks, I think, and so it's going to be a lot of fun.
It's going to be fun.
Oh, good stuff.
Thank you.
All right, guys. Thank you so much. Have a great rest of your day.
All right, you too.
Bye-bye.
Bye-bye.
All right. Love you guys. Bye-bye.
Love you too.
There you go, Dr. Stuart Nunnally and Dr. Lane Freeman. I just love them. Isn't there something just, it's like what Kate says, there's something just really inviting about his voice, Dr. Nunnally's voice. He's got something like, there's just something about him, just a nice way about him. You know those people you run across that, Dr. Freeman's the same way. They just have a nice way about them, and big fans of what they do. And one of the things I'd recommend all of you guys do, this is what we did and this is what we do is, they take Care Credit over there. And so we just signed up for Care Credit, and it's expensive. This stuff is really expensive. I will say, depending on what you need, if you just need a cleaning, if you just need something like that, it won't be that expensive. But if you need like an extraction, which is basically a surgery, and they have to do IV, and afterwards they put you in, you get like an acupressure, and they come and they bring smoothies to you, and they give you vitamin C, and they use something also called Versed there, which is a more holistic way of using conscious sedation. Versed, I think, is what they use, and so it's really incredible because you'll be getting a procedure done, and you kind of, like, if you have to go to the bathroom during the procedure, you can actually get up and go to the bathroom. But when you're done having the work done, you have no idea what happened. It was just like you were out the whole time. It's really a bizarre experience. There are a lot of biological dentists out there, but there's just something about Dr. Nunnally and Dr. Freeman and Dr. Owens, and I think they have another doctor there now who we haven't met. I mean, what other doctor is going to, before he performed surgery on you, which is what he did for both Kate and I, we both had 2 root canals taken out, as well as my 4 wisdom teeth cavitations. What other doctor is going to sit with you and pray with you before he does a surgery? I mean, this is the level that this guy's at, and constantly learning, constantly understanding, constantly researching new books and new research and new papers, and he's on the cutting edge. And there's a lot more that we could have got to, and I think maybe when we're out there, what we'll do is we'll do a podcast with him in person. Maybe it'll be on video, maybe it'll just be audio only, but I think what we'll do is cover. There's so many other subjects that we could have covered, but I know Dr. Nunnally had a previous engagement. So this is a weird serendipity, weird circumstance. So Kate, I'm not sure if you're listening right now, but this is what he told me before. So Dr. Nunnally has 3 boys. I think they're 3 boys, and one of his boys has twin girls, and he was joking before the show that they're going to set his girls up with our boys. It's so funny. What's interesting is that his son that has the 2 twin daughters lives in a neighborhood and lives across the street from another couple who has twin boys whose names are William and Benjamin. I mean, isn't that crazy? I mean, talk about, and I think one of the twins, his granddaughter twins, is named Kate. I mean, that's just like the stars aligning, It's I don't know, for what that's worth. I thought, Kate, if you're listening to this, you might find that interesting. But just amazing people. I really love them. Here's one of the things that I want you guys to take away from this, and I really implore you to take your oral pathology and your oral health seriously, because like he was saying, Dr. Thomas Levy was saying in that book that, it's his contention that on a physical level, the root cause of diseases are, root canals, cavities, cavitations, these types of things. And I really want to implore you to make it a commitment, maybe in 2019, sign up and get a Care Credit account and apply for that and go see a biological dentist. It doesn't have to be him. I'm sure our friends and family think we're crazy for driving halfway across the country to go to a dentist. Someone was saying something recently where they're going to go to a dentist, and, and it's unfortunate that most dentists don't have the understanding that Dr. Nunnally does, where, there's meridian systems and your teeth affect different organs and organs can affect different teeth. And there's a flow between the body and how the body communicates to itself. And it's unfortunate that modern dentistry doesn't understand that connection. Because if you're to look at, like, no one would ever, no average person, especially no average, conventional dentist would ever make a connection between cancer and oral health. They would never put the two together. But, talk about a high approach, a level that's above most every other thing with regards to our health. I mean, on a physical level, if this stuff is happening and people are having cavities, cavitations, and it's really affecting their health. If I were sick, if I were, dealing with any kind of chronic degenerative disease, the first thing I do is I get my oral pathology looked at. I'd go to a guy like him. One of the things that I really recommend for people is to jump out of one world and into another. The world of money is a fake world, and we all know it. Money is made by our signature. And money is just a fake invention of mankind to be able to exchange value for one physical good for another, right? And so I just say, you know what? My health is worth it. I'm going to put this stuff. I got this plastic credit card here. I've got whatever amount the Care Credit I applied for and they allowed me to have. I'm going to go get some real work done on my health and get to the root cause, most literally, of what could be an underlying health condition. Or maybe I just want to feel good. Or maybe I want to live a long time disease-free. This whole money, plastic, game is a fake game. And when you start realizing that and say, you know what, I just got approved for a bunch of fake money on this credit card. I'll go use this credit card and get actual work done on my health. It's going to improve my health. To me, it's a no-brainer. I'd rather just pay the card off for a number of years and get that work done, because to me, it's worth it. It all comes down to our value systems. It comes down to, how highly we think of ourselves, how much we love ourselves, how much we want to take care of ourselves, and how much we feel like our life is valuable and it matters, and what kind of contribution we're making to the world if we want to be around for a long time. And investing in these types of things, although expensive, I think is one of the best uses of your money. And I don't get any benefit for telling you that. There's no financial kickback. I'm just a really big fan of Dr. Nunnally. And even if he did give me like a referral fee or whatever, it doesn't matter to me if he does or doesn't. To me, he's the number one biological dentist in his practice. I mean, Dr. Freeman is amazing. Like I mentioned, she was the one who we went and saw first and got my silver amalgam mercury fillings taken out back in 2010. So I just can't recommend their practice enough. Like I said before, I mean, what other doctor is going to pray with you before performing surgery? What other doctor is going to give you this conscious sedation and do biological testing and make sure that every one of the materials is biocompatible with your health? I mean, imagine putting something in your body infused into an organ and not even knowing if it's biocompatible or not through blood testing. I mean, that's what conventional dentists are doing, is they're putting things in people's mouths permanently, some of them, and they're not even testing whether or not these things are compatible with their own physiology. So to have something in your body that's not compatible is like getting an organ transplant and not having it be compatible. That's why organ transplant patients need to take immune suppressing drugs so that their immune system doesn't fight off and reject an organ, right? But when you do like an implant or something, we didn't even talk about that, because as you can see, I have a gap in my teeth right here from the root canals, and I don't wear the retainer. But putting something in your body that your body doesn't recognize is constantly going to be a burden to the immune system. This is the same reason why I didn't have a surgery, ACL reconstructive surgery, because I tore my ACL, but they wanted to do a cadaver, and they wanted to adhere the cadaver tendon into my bone and into my ligaments with a metal plate. And having a metal plate in your body is going to be a tremendous burden on your immune system. And let alone, how does that metal plate interact with the coming 5G EMF wireless radiation that's going on? And so having that inside your body is going to be a constant burden. And so I'm all about removing as many things as you possibly can that are causing a burden on your immune system. Let's say like your immune system is like it's just like any other system. It requires energy to work and to operate, right? So if you're like running a marathon and then all of a sudden you put ankle weights on, that's a burden to your ability to finish the marathon, right? So with everything that you're adding to a marathon runner, it's an encumbrance on their energetic ability to complete the marathon, right? So if the person were just with running shoes and light shorts, they could run a full marathon, and that's the full amount of energy that they would have. Then as soon as you start putting heavier and heavier clothing on them, maybe they can only run like half a marathon or a quarter of a marathon with ankle weights and a weighted vest, and all these types of things are encumbrances on their energetic ability to complete a full marathon. And our body, in my opinion, should be able to live for at least 120 years. But the problem is that we have all these burdens on our immune system in the same way that marathon runner would put ankle weights on. We have all these burdens that are hampering us and slowing us down and using more energy. And so there comes a point in our lives, whether it's glyphosate, whether it's EMF, whether it's blue light toxicity, whether it's dirty electricity, root canals, toxic food, all these toxins and chemicals that we're exposed to, after a number of years of these exposures to all of these things, it's just a teeter-totter. Your immune system no longer has the ability, or I should say the energy, to be able to deal with a bacteria that's now coming on from, let's say somebody who was sick sneezed all over you and you got a bacteria, that might cause you to have symptoms of a flu, for example. Now your body's using 99% of its energy, the immune system, to deal with all of this glyphosate and non-native EMF and blue light toxicity and dirty electricity and root canals and all these things. It's constantly trying to deal with that. And so it only has 1% to deal with this new bacteria that you just got exposed to. So it's not that you got sick because someone sneezed on you. It's you might get a flu or a cold because your immune system is not working properly. So instead of taking things to boost your immune system, how about we start removing the encumbrances that are causing our already amazingly strong immune system to function the way it should. So if you take off the ankle weights, you take off the weighted vest, you take off the glasses, the hat, the heavy shirts, the pants, and all these things, then all of a sudden you're an Olympic runner and you can run 26 miles, do the marathon, all because you just remove those things. But let's take it a step further. Like, let's say we remove those things, right? And then we take immune enhancing supplements and we get out in the sun, which boosts our immune system. We actually do things like the relaxed far infrared sauna, which helps to increase heat shock proteins and increase immune system functionality. So we start doing these things that actually make the system work even better. So then you're not just looking at being able to run 26 miles, which might be the average lifespan of a modern American today, which might be 75, 80 years. Now you're looking at living much longer with more energy in a helpful and a healthy way. And so when you start removing all the encumbrances on your immune system, then you start then adding things in like medicinal mushrooms, like light therapy, and all these things that you can do to enhance your immunity then you're looking at like a long, healthy, really long, healthy, disease-free life. And then you can take it even further, stem cells. You can do all kinds of crazy biohacks and therapies and things like that to increase telomere length and all these types of things, taking ashwagandha for that. There's all kinds of things that you can do, but to me, it makes the most sense to remove the encumbrances first. And the biggest one that I'm thinking in today's world is probably a combination of non-native EMF in the form of blue light, dirty electricity, wireless radiation, and oral pathology in the form of mercury amalgam fillings and root canals and cavitations. I think those two things are probably neck and neck. That's just coming from my 15 years of experience in this field and research that I've done. To me, it seems like those things are placing the biggest burden on our immune system. That's not even counting glyphosate, because if your body wasn't constantly dealing with blue light toxicity and dirty electricity in the walls and dealing with all of this electrification of our society, and it didn't have to deal with the root canal and the toxic mercury amalgam filling, if it had the energy from those two things, then it might be able to deal with something like a glyphosate or something like a toxic chemical, right? But constantly working on these types of things, I think, is really important for all of us to radically improve our health, removing the encumbrances that are causing a tremendous amount of stress on our system. That's so critical and so key, I think, to living a long time and having the energy to do the things that you're supposed to be doing on this planet. That's really ultimately what it's all about, because none of us want to be like, a vegetable in a wheelchair, dying for 20 years before our time to go, right? We all want to be passionately consumed in the work that we're supposed to be doing in the world. That's what we're supposed to be engaged in. And finding out what that is huge, because what good is it to do all this kind of work that I'm talking about, getting your root canals done, getting your light environment, getting your home environment all dialed in, if you're not happy with your life, if you're not doing the work that you're supposed to be doing. It doesn't make any sense to do all that. And so that's where a lot of this stuff comes from: self-love and valuing yourself and feeling like you have a worth and feeling like you have something on the planet that you're able to contribute and help other people live their life. That's just, if you don't have that, then there'll be no motivation to do all the other stuff. So you got to cultivate that as well, and finding purpose, finding meaning, having love in your life, relationships, seeking that out, and contributing and being involved in people's lives. That connection where we can share biophotons with each other is so key, right? I mean, no virtual online meeting with someone can replace seeing someone and smiling and giving them a big hug. I mean, nothing replaces that. So this is why human interaction is really important for all of us. And I think that the more we isolate ourselves, the sicker we become. And it's really important for us to make sure that we're on a path of personal development, spiritual growth. All of these things are so important. And, why would you drive across from California all the way to Texas to get your teeth done? Because we care about ourselves. We want to be around for our kids. We want to live a long time. We have a lot of work to do. And so, a lot of people don't have that. A lot of people don't have a desire to live like that. And I think cultivating that and recognizing that you don't have that and working on that and raising your dopamine, lowering your depression levels, becoming more active and involved in the way the world works and helping other people. I think this is really key, because that cultivates a level of self-care that you're going to want to participate in. You're going to really start valuing yourself to go do these things and to spend whatever amount it costs. When I'm at the health food store, it's like, I don't care what something costs. I'm buying it because, I'll wear the same clothes for 10 years or for 5 years. If there's not enough money to go around, I'll do whatever it takes to get the things that I place the most value in. And so it's a value proposition, and it's a value question. It's primarily that. How much do you value your health? And like I said, before we go out and buy, Vitamix blender or go out and do these types of things and eat the latest superfood, I think it would be really most beneficial to work on our environment, to work on our oral pathology, all these types of things. And so I hope you guys enjoyed that show. If you enjoyed our show, make sure to subscribe to our channel. We're doing new shows every week, every Monday, Wednesday, Friday, so make sure to subscribe to us. One of the things that I wanted to tell you about with regards to improving your environment and improving where you sleep is this Magnetico mattress pad. This is what I like about this thing, is that it's one of those things that's like a passive way to improve your health, because all you have to do is basically sleep on this Magnetico mattress pad, and it does the same thing as sleeping on a mattress pad. You're going to be sleeping anyway. So the benefits of magnetism are absolutely massive. And when you start looking into why human beings exist and the electron chain transport and the mitochondria, and how basically it's our electrons spinning around, and it's the physics of photons and electrons, and how these things interact with our health and create cells through the mitochondria. It becomes increasingly clear that magnetism is incredibly important. And what's cool about this bed is that it's like I think it's like 80 pounds or more. There's 1,200 magnets all ordered in the proper position, and we have the 10 Gauss. They have a super sleep system, which is a 20 Gauss, which we don't even have. But let me play you this clip from Jason Prawl. It's really good. He's talking about the Magnetico sleep pad here.
I just heard those devices that you had during the break, by the way, and I actually want to add to that because that's really cool stuff. I actually have the Magnetico sleep pad myself. I've got the 20 Gauss. It actually is really important. And what's happening is with the Earth, according to research and some pretty good science, that the poles are actually wandering. Instead of being sort of perfectly aligned and opposite of each other, there's multiple poles on the north and south, and they're actually wandering around. And basically what that does is it decreases magnetism around the Earth, but it does so in an uneven way, in an undistributed way. So it's not exactly uniform around the planet. What's happening is we are getting extra solar energies coming to the Earth. So we're actually seeing like UVC is now increasing on the planet because of our magnetic field. Our magnetic shield is not as protective. So it's really interesting stuff what's happening as we're moving into new parts of the galaxy, and we're getting new energies and all this stuff is changing. So I actually have a Magnetico sleep pad.
Yeah, the Magnetico is, in my opinion, it's one of the best health tools that we've invested in, because it's like I said, it's like you get 8 hours of this amazing bathing your body in magnetism. And moving into a 5G world, this is going to become even more and more important to bathe your body in a magnetic field in order to protect yourself from 5G, from dirty electricity, from all these sort of things that are happening to our environment. And I just cannot recommend this thing enough. And I think the good folks over there, Dr. Bonley, we did a whole show with Dr. Bonley. Actually, you can click on a link and listen to the science of how he put this together and what it does to the electrons in your body. It's pretty fascinating. Yeah, he set up a code. EHR10 will get you 10% off your order. So make sure to check out the Magnetico mattress pad. Nikola Tesla said, if you want to find the secrets of the universe, think in terms of energy, frequency, and vibration. That's why we have in our store light, water, magnetism as the top 3 categories there. So make sure to check out our store. And finally, I wanted to tell you guys about this Surthrival products. A lot of you guys have been purchasing this lately and supporting our show, and most of you guys are doing on like an ongoing basis, which is awesome. They have some really, really great products, and we've had Daniel Vitalis on the show multiple times. They're products that I love. A couple of them I haven't tried yet, like the Digestive Bitters. I haven't tried that one yet, or the Taboo, which is like an aphrodisiac kind of a product. It's all 100% natural, of course, with Daniel Vitalis. That guy's just on top of it when it comes to this kind of stuff. But his colostrum is really cool. I love their colostrum. Colostrum is obviously nature's first food. It's what we get. All mammals. All mammals take colostrum as their first food. And it's amazing because it has a number of different immune system properties to help boost and stimulate your immune system, which is great. But it's also really tremendous for healing the gut as well, sealing those tiny perforations in our gut from eating foods high in lectins and causing leaky gut and things like this. So if you were to combine the colostrum with the aloe vera that we mentioned during today's show, that would be a really great gut food. And maybe also you can add some bone broth to that as well. They also have pine pollen, which is incredible for sexual strength. Combine pine pollen with some maca, and then you'll be really vigorous sexually, would be the way to put it. Pine pollen is really great for that. It's the only food that I think actually contains testosterone, and so it's a raw pine pollen. You can get it in tincture form, really incredible. And then there are other products I just love. The elk velvet antler, which is really great for your testosterone levels and balancing your hormones for both men and women. And then they have the reishi and the chaga, which is their sort of flagship products. And you can learn all about reishi, what it does. I'm a big fan. They do this dual extraction, which is cool because they do like a heat water soluble extract, but then they also do a alcohol soluble, an organic grape alcohol. And what that does is it removes and pulls some of the terpenes, some of the additional medicines that can't be removed from water. And so what they do is they boil that part down, and then they combine the two together in what they call a dual extraction. And so you're getting the medicinal compounds, the immune modulating and building compounds of these things. Chaga and reishi are known as the king of the mushrooms, and that's why, Daniel could have focused on a lot of different mushrooms, but chaga and reishi are the king and queen of mushrooms, and that's why they're number 1 and number 2 in the traditional Chinese medicine system. Chaga is king, and reishi is queen. And so they have all these in different strengths and different formulas. I'm a big fan of what they're doing over there. It's so Thrival. So if you guys want, make sure to go over there and go to our store. And if you're watching on the YouTube video, there should be a link in the description if you want to grab some of these, colostrum, which I love all their products. I got to try the other two, like I mentioned, but they're really good stuff. And by doing that, you support our show. So I really appreciate that. You guys are just incredible. So thank you guys for visiting our sponsors. And, these are all people that we've had on the show that we like, that we know personally, and we just really stand behind their work, and we're really honored to have them a part of our show. So let me pop on over to the chat room and see what you guys are chit-chatting about. You guys are talking a lot. Let's see. Wow. I feel like I'm missing out on a conversation that so Teresa says, I'm so afraid of conventional dentists now after last one screwed up a root canal. I now only trust Dr. Nunnally to fix the damage that was done previously. Wow. Yeah, Dr. Nunnally. Teresa, have you been to see Dr. Nunnally, or are you considering going to see him? Teresa says, on disability for glaucoma, got denied by Care Credit, so my sister, Chris, set up a GoFundMe. Takes time to save and to pay cash. Wow. Teresa, something for glaucoma you might want to look at. Dr. Jack Cruz and Dr. Gilbert Lang, or is it Doug Wallace, I think, are basically now saying that these types of ocular issues, these types of vision issues, are the result of toxic blue light, over blue light toxicity. So you might want to look at blocking blue light. In fact, if I were you, I mean, in fact, I don't even have glaucoma, and I'm already blocking blue light. So blue light is a major issue in today's culture, and that's why I talk so much about it. And there's new research being coming online all the time about blue light. So make sure to block blue light, and it's a whole strategy to do that. But Christina says here, I've traveled from BC to Tijuana to go to a biological dentist who worked with Tom Levy. Even so, he wasn't very cautious, in my opinion. Wow. Christina, what place did you go to? I'm curious if you're able to say. I think vaccines are far bigger stress on the body and oftentimes virtually impossible to rid oneself of the damage, plus the synergistic toxins and pathogens. Yeah, that's probably a good thing, right? Vaccines, yeah, I would say that. That's probably true. Yeah, vaccines. We've done a lot of shows on vaccines. Vaccines, you think about vaccines, a non-native EMF in the form of blue light and dirty electricity, 5G, wireless radiation. So you got vaccines, non-native EMF, and then oral pathology. That's probably the three-headed monster right there. Can people use the magnetic mattress pad if someone has metal rod implants from back surgery? Ooh, interesting. I would probably say no, Christina. I don't know. You might want to check with Dr. Bonley and Joan. Joan's a really great contact that we know over there at Magnetico Sleep Pads. That's a good question, though. I never really thought about that. I guess if you think about it, too, a lot of people are dealing with metal in the body, right? Because people might have implants, right, from surgeries, or they may have like braces on or something like that. So I'm not sure how the magnetic field would interact with having metal on, but I probably would lean towards not getting one. But I'd do research. I'd probably ask them first. Teresa says, I meant to ask Dr. Nunnally if he's seen cases of vision improvement after fixing root canals or cavitations. At least the peripheral vision. Maybe can you ask him next time he's on Justin Stellman? Yeah, Teresa, I know anecdotally, of people who have had that issue. I know someone in my life personally whose vision was going, and they had, I forget, some sort of disease. But once they fixed their root canals, their entire vision came back. Yeah, and I'm not making that up. This is a friend that or not necessarily a friend. I guess I would say I would call him a person that I know, and he shared that story before. So, I can't say it's the case with everybody, but there's definitely a connection, at least physically, because if you think about how far the eyes are from the teeth, there's definitely going to be some sort of connection there. But you know what's funny about this type of thing is, like, sometimes people will have an issue with it, going on with their health, and they think that, like having a root canal fixed or doing some sort of like maybe hyperbaric oxygen chamber or something like that, they think that it's going to fix it, right? And then what happens is they go out and they get this procedure done and it doesn't fix it, and they think, oh, it was just a waste of time. But it really wasn't, because even though it didn't fix it, it removed one of those blockages, those hindrances. So it would be like running the marathon in the analogy I was giving before, and instead of having 2 ankle weights on, now you have 1 ankle weight on. So now you're a little bit more free, even though you're imbalanced, but for sake of argument. But now you're a little bit more free and you have a little bit more energy, and you can use that energy in different ways. But Teresa, if I were you, I would definitely do my best to see about going to see somebody like Dr. Nunnally or Dr. Nunnally himself. And if you go see him, if you guys go see Dr. Nunnally, we don't get any kickback or anything, but just tell him we sent you. I'd love to know that, it's worth his time to be on our show and all of that. So yeah, just, tell him we said hello, and I mean, he's amazing. He's amazing. Do you think EMFs interact with the mercury in teeth? I don't have scientific proof, Maria, for that, but I know that it does. I would be absolutely shocked if it didn't. EMFs, I know I know when people have the regular silver fillings, sometimes they can even hear like radio, like voices in their head. Have you guys ever heard that? Where I've heard people say this, where sometimes if they catch the metal filling in a certain area, they can actually hear a radio station in their head. It's unbelievable. It wouldn't surprise me at all. So if EMFs are affecting wireless radiation and 5G, this aspect. And one thing that we didn't talk about too is this mercury and what it does to the blood-brain barrier in our brain, and how it affects, and as well as the brain of babies. And EMF affects the blood-brain barrier. Dirty electricity definitely does, of developing humans. And then you have on top of it the mercury doing the same thing, breaking down the blood-brain barrier. Maybe that's part of what's going on with autism going on these days. So it's something to consider. This is, like Christina, you said before, adding vaccines to this mix, I think is probably one of the biggest things affecting our health. Vaccines, non-native EMF, and oral pathology are 3. If you can dial those things in your life, I think your health is going to be tremendously impacted. So anyway, thank you guys for joining us. I hope you guys enjoyed the show. Make sure to visit our sponsors for today's show, the Omica Organics 12-stage reverse osmosis water filtration system. That thing is awesome. Big fan of it. We use it. It's underneath our sink. And if we ever move, we're taking it with us because we love it. And also, don't forget to check out the Stockton Aloe 1 if you want to improve your digestion and lower inflammation in the body, as well as a Magnetico sleep pad and the Surthrival colostrum, the pine pollen, the elk velvet antler, which is great for testosterone and regulating hormone levels, and then the Shotgun Reishi that they have, dual extraction. Great stuff at Surthrival. Big fan of their stuff. So make sure to go check them out. I hope you guys enjoyed the show. And don't forget to subscribe if you haven't yet, because we have new shows every Monday, Wednesday, Friday. So this Monday, we're going to have Matt Maruka. We're going to be talking with him about the light diet. I'm not sure if that show is going to be live or not. So it may not be live, but because I think that we're going to be borrowing his audio equipment, because we're going to be doing it in studio and our microphones cut out. So I don't want to produce a show and have the mics cut out. That's not good audio. So that may not be live. I have to check with him. And then Scott Nelson, we're going to be talking with him next Wednesday about photobiomodulation, specifically this Juve red light therapy device, which is known as LLLT, low-level laser therapy. You can search for that on PubMed and look at all the studies and crazy experiments they've done and how photobiomodulation, red light therapy, affects our mitochondria. So that's going to be a good show on Wednesday. Then on Friday, Dr. Randall Tent. That's going to be a great show. All moving towards Christmas, guys. I hope you guys are enjoying your Christmas. Have you done all your Christmas shopping yet? I have done zero Christmas shopping. Actually, my parents are going up to Seattle for this Christmas. They're going to be driving up there. And so they're not going to be here. We're going to be doing Christmas with Kate's family. And we haven't done any Christmas shopping at all. At least I haven't yet. I'm wondering if you guys have. Oh, Teresa said, thank you. I live an hour away from him. Cool. Maria says, I've had quite a bit of plaque around a tooth that I've had before I removed the amalgam safely. You know what, Maria? You might want to look at that phosphorus 3.5 balance in the serum levels of your blood. You might want to look into that and bringing more alkaline foods to get that phosphorus to 3.5 or above, so that you don't get decay in your teeth. That's something I'm going to be focusing on and looking more into, the phosphorus 3.5. So all good stuff. I hope you guys enjoyed the show. Make sure to subscribe. And also, I wanted to tell you guys too about the Extreme Health Academy. If you haven't checked this place out yet, we just released a course, a brand new course on diabetes called Diabetes Mastery. And as you can see, there's 234 videos just in the courses section, 28 hours of content. So this is all content that like you and I should have been told about in school, but unfortunately we're taught, a bunch of stuff that doesn't really matter. So we're not taught how to take care of ourselves in school. So this is really important stuff to understand how to get a good sleep, how to recover your adrenal glands if you have adrenal health issues, diabetes, blood sugar issues, insulin, pancreas, all how to take care of your body. Super important. These are all high-level courses taught by Dr. John Bergman in a professional way. And this will give you the tools and everything you need to overcome this kind of stuff. We have a whole course on prevention of cancer and how to heal cancer naturally, along with heart health optimization, building invincible immunity, right? Building your hormones, balancing your hormones and improving your digestion. The age-old quote is, all disease begins in the gut. So all of these courses are now available and free for you to join. If you guys want to join, let me give you a free coupon code for the Extreme Health Academy. If you guys want to join, it is EHR14. Let me put this in the chat room for you guys. I'm telling you guys, this is like an amazing, amazing place. And I'm just a big, big fan of this academy that we've been able to build and everything that we've been able to do there. And one of the cool things I'll tell you in just a second about the academy, a cool new feature coming up. Let me just put this, https extremehealthacademy.com and then use the code EHR14. That will give you a free 14-day trial. But here's something cool that we're working on. So every single week inside the Academy, we're answering your health questions. So if it's me and Dr. John Bergman, we're covering all your health questions. And then if it's me and Michael Bergman and my wife Kate, we're answering your health questions as well. So every week we're answering tons and tons of questions. And what we're doing is building a health database inside the Academy. So now everything is going to be categorized, and you can find everything on one page super quick. So now if you have a question about diabetes, you have a question about surgery, how to recover or prepare for surgery, or how to regulate your blood sugar, or how to deal with food addictions, or how to deal with liver issues or glaucoma or eye issues or anything like that, everything is going to be alphabetized and categorized. And we're calling it the health database. And it's really cool. So it's going to link off to every time we answered every one of those questions and give all the full information as we possibly can of everything from light to spirituality to physical, chemical, and emotional stresses to removing, and taking certain substances and products and herbs, and, even different energetic things, like different energetic tools, like using radionics, and bringing everything to the table that we know that will help deal with any of these conditions. We're making a health database. So super, super excited. I can't wait for that to be rolled out. I think it's going to be probably in the next couple months is when that's going to, it's a huge undertaking, as you can imagine, categorizing everything and putting everything in there, but it's happening as we speak. So I'm super excited about that. So that's going to be available next couple months. But until then, there's the forum. We've got thousands of members in the forum, all helping each other, sharing ideas and encouraging one another and sharing what's working and what's not working. It's just an awesome place, and I feel really grateful to be a part of it, and to have an audience like you guys, some of who are inside the Academy, and just helping everyone I possibly can, and live a better life. That's really what it's ultimately all about. So anyway, I hope you guys enjoyed the show. Let us know if we can ever help. We love you very, very much. Make sure to visit our sponsors. Make sure to go through our Amazon link too on our homepage if you want to support the show and you want to support everything that we're doing. Do all your Christmas shopping through our Amazon link on extremehealthradio.com at the bottom of the page. We would greatly appreciate that. It'd be a great way to support the show. All right, guys. Love you very, very much. I will see you on Monday, maybe, with Matt Maruca talking about the light diet and how light affects our mitochondria. You guys are amazing. Thanks for subscribing. Thanks for commenting. Thanks for sharing the video. I'll see you on Monday. Love you guys. Talk to you soon. Bye-bye.
No material on this blog is intended to suggest that you should not seek professional medical care. Always work with qualified medical professionals, even if you educate yourself in the field of live food, nutrition, and alternative medicine. I'm not a doctor, nor am I offering readers medical advice of any kind. None of the information offered here should be interpreted as a diagnosis of any disease, nor an attempt to treat or prevent any disease or condition. While information in this blog is discussed in the context of numerous conditions, it can be dangerous to take action based on any information in this blog or to start any health program without first consulting a health professional. The content found here is for informational purposes only and is in no way intended as medical advice, as a substitute for medical counseling, or as a treatment/cure for any disease or health condition, and nor should it be continued as such. Always work with a qualified healthcare professional before making any changes to your diet, prescription drug use, lifestyle, or exercise activities. This information is provided as is, and the reader/viewer assumes all risks from the use, non-use, or misuse